Welcome. I'm Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review for you the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the July 2012 print journal, along with the accompanying editorials. The special article entitled Diversion of Drugs Within Healthcare Facilities, a Multiple Victim Crime, Patterns of Diversion, Scope, Consequences, Detection and Prevention, was written by Dr. Keith Berge and colleagues from Mayo Clinic in Rochester, Minnesota. The authors describe that diversion of controlled substances is not uncommon and can result in substantial risks not only to the individual who is diverting the drugs, but also to patients, co-workers, and employers. They believe that all healthcare facilities should have systems in place to deter controlled substance diversion and to promptly identify diversion and intervene when it is occurring. The authors describe a system developed at Mayo Clinic for evaluating episodes of potential drug diversion and for taking action once diversion is confirmed. This is an important multidisciplinary effort that includes, among others, the departments of pharmacy, safety and security, anesthesiology, nursing, legal counsel, and human resources. A video interview with Dr. Berge can be viewed on the homepage of Mayo Clinic Proceedings. The accompanying editorial, A Need to Establish Programs to Detect and Prevent Drug Diversion, was written by Dr. Cynthia Leon from Weill Cornell Medical College in New York, New York. The author comments that the success of a drug diversion detection and management program requires education, cooperation across several hospital divisions and offices, personnel, time, and money. Even though establishing such a program requires significant resources, the cost of not doing so, in terms of physician and patient safety, is even greater. The original article entitled Prognostic Implications of Q-Waves and T-Wave Inversion Associated with Early Repolarization was written by Dr. Abhimanyu Oberoi from Stanford University School of Medicine in Stanford, California, and colleagues from several other national healthcare institutions. They retrospectively examined close to 30,000 electrocardiograms performed at a Veterans Affairs healthcare center. Inferior or lateral early repolarization was present in 2.3% of these patients. The risk of cardiovascular death increased only when Q waves or T wave inversion accompanied the early repolarization. These findings confirm that early repolarization is a benign entity. However, the presence of Q waves or T wave inversions together with early repolarization predicts increased risk of cardiovascular death. The accompanying editorial, ST sigma elevation, defined by the company it keeps, was written by Dr. James O'Keefe from St. Luke's Mid-America Heart Institute in Kansas City, Missouri, and colleagues from several national healthcare institutions. The authors discuss different patterns and various causes of ST segment elevation, but also state that there are unresolved issues. These issues include the ST segment elevation associated with left ventricular hypertrophy. The authors call for population-based studies to better understand the incidence of the various early repolarization patterns and the risk of early unexpected death in the general population. The original article entitled Gastric Acid Suppression and Outcomes in Clostridium Difficile Infection, a Population-Based Study, was authored by Dr. Sahil Khanna from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic and from the Hofstra North Shore LIJ School of Medicine in New Hyde Park, New York. This population-based study in Olmsted County, Minnesota, examined the records of 385 patients with Clostridium difficile infection over a 15-year period. Among those, patients with Clostridium difficile infection who underwent acid suppression with proton pump inhibitors or histamine type 2 blockers were not more likely to experience severe or complicated Clostridium difficile infection, treatment failure, or recurrent infection. A video interview with Dr. Kanner can be viewed on the homepage of Mayo Clinic Proceedings. The original article, Clinical Spectrum, Frequency and Significance of Myocardial Dysfunction in Severe Sepsis and Septic Shock, was written by Dr. Juan Pulido from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic and several healthcare institutions in Japan. Prospectively examining 106 patients with severe sepsis or septic shock over a 16-month period, the authors found that myocardial dysfunction is frequent in patients with severe sepsis or septic shock and has a wide spectrum, including left ventricular diastolic, left ventricular systolic, and right ventricular dysfunction. Although the evaluation for the presence and type of myocardial function is important for tailoring specific therapy, the presence of dysfunction in patients with severe sepsis and septic shock was not associated with increased 30-day or 1-year mortality. A video interview with Dr. Pulido can be viewed on the homepage of Mayo Clinic Proceedings. This month's concise review for physicians is entitled Clinical Pearls in Dermatology and was written by Dr. Lisa Draghi and colleagues from Mayo Clinic in Rochester, Minnesota. The authors present 6 short cases with dermatology problems that each are followed by a multiple-choice question and an in-depth discussion that ends with a concise clinical pearl. Issues addressed in the current review include erythema multiforme, scabies and scleroderma, and dermatologic manifestations of meningococcal disease and Staphylococcus aureus infection. The article entitled My Treatment Approach to Rheumatoid Arthritis, written by Drs. John Davis and Eric Mattison from Mayo Clinic in Rochester, Minnesota, is our latest entry into our new Diagnosis and Treatment Guidelines category. The past decade has brought new classification criteria for rheumatoid arthritis, better definitions of treatment outcome and remission, and the introduction of biologic response-modifying drugs that are designed to inhibit the inflammatory process. The authors discuss new treatment principles and treatment approaches and provide a concise summary of their recommendations. A video interview with Dr. Davis can be viewed on the homepage of Mayo Clinic Proceedings. Again, please be reminded that authors or co-authors of 4 of the articles we have discussed, Drs. Berge, Kanner, Pulido, and Davis, have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. There, you will also find an additional video interview on an article entitled The Elders Risk Assessment ERA Index, an electronic administrative database-derived frailty index, can identify risk for hip fracture in a cohort of community-dwelling adults. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Lori Erickson from Mayo Clinic in Rochester, Minnesota, who has been on the editorial board for many years and was recently named Associate Editor. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the July 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. We have fantastic material lined up for the upcoming issues. For example, the August issue of Mayo Clinic Proceedings will address the responses of U.S. healthcare delivery organizations to the challenge of reducing healthcare costs while improving healthcare quality. In a series of commentaries organized by Dr. David Ballard from Baylor Healthcare System in Dallas, Texas, representatives from several leading healthcare systems across the United States discuss why or why not their institutions chose to participate in the Accountable Care Organization component of the Medicare Shared Savings Program. Our August issue will go live on Science Direct on August 2nd and on our own website on August 7th, 2012. Please check back at that time to hear the multimedia summary of highlights from that issue. In the meantime, please continue to share with us any suggestions you might have for improving the quality of our print journal and website and of our services.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.